Hi, everyone. I'm Sandra Schwartzman, your host for today's webinar, Understanding Long-Term Care. I'm with our presenters today, General Michael Meese, Executive Vice President at AFMA, and Carlos Perez, Chief Operating Officer here at AFMA. We have a few slides to go through with you today. It'll take about 20 to 30 minutes. And as we go through that, we will also have a quick Q&A session where we will answer and address your questions. To go get started today, we have a quick question that you will see on your screen. If you can take a few minutes just to answer that, that would be great.
Yeah, this gives us a good idea of whether or not we have AFMA members out there or who else is tuned into us. And that's interesting to see what the results are.
Well, thank you very much, everyone. AFMA stands for American Armed Forces Mutual Aid Association and is the longest standing not-for-profit association that empowers military families with affordable financial solutions. We accomplish this by being the premier provider of affordable life insurance, expert investment management. We provide customized residential mortgages and our exclusive survivor assistance services, all for the military community not-for-profit. This presentation is educational and is for general information only and is not specific investment, legal, or tax advice for any of you individually. Do not rely on this presentation alone to guide your retirement savings decisions. Since each individual situation is unique, your retirement decisions will not necessarily be the same as other service members. For individual advice, please contact us directly. We produce this webinar series in-house with our own professional staff as a service to our members and to help them better understand the resources that are available to them. I'll now go ahead and turn it over to Mike, who will review our agenda.
Thank you very much, Sandra. Appreciate you putting this together. We're going to talk about long-term care, and many of you may have tuned in 2 weeks ago when our colleagues from AFMA Wealth Management and Trust discussed some of the financial aspects of long-term care. We will touch on that and reinforce many of the conclusions that they had, discussing what long-term care is, what the issues have been lately with it, and then what options people may have with regard to long-term care. Before we jump into this, I think it's important to find out if any of you out there actually have long-term care insurance, because I think some of you may. If you can respond to the poll that's on your screen, we'll just keep it up there for a couple or 3 minutes, and I'll introduce my colleague, Colonel Carlos Perez, a retired colonel who's the Chief Operating Officer of AFMA. Okay, now I think we'll close the poll and turn it over to you, Carlos.
Yeah, cool. And clearly by the results of that poll, I think we have great interest from our audience in long-term care today. So, Mike, I thought I would start out by talking a little bit about what this is so that we kind of establish the fundamentals and then going into a couple of other areas. And so long-term care is care that is required when you can no longer perform what are called tasks or activities of daily living. And we've listed them here on this slide, and they're bathing, dressing, transferring, eating, toileting, and continence. And we shouldn't mistake long-term care with standard medical care that you might get through your health insurance or maybe even the VA. It is care unique to tasks of everyday living. And so let's go ahead and look at the next slide, which gives us an idea of the scope of the issue. And what we see is that slightly less than half of people under 65 years of age need long-term care. But as you approach age 65, you're looking at about 7 in 10 people that will need long-term care services. Now, I want to just kind of make an important point here, and that is that it may not be the case that you meet multiple conditions, but rather that in some cases you may meet one or more of these conditions of the activities of daily living that you can't perform. So that's the need. And so, Mike, I thought it would be good next if you could talk a little bit about who provides this kind of care.
Yeah, and when you think about it, with 7 in 10 people needing long-term care, clearly this is a huge industry, and we know that it is, but frankly, most of the long-term care that is provided by another family member. The Commission on Long-Term Care that Congress put together concluded that the value of family caregivers providing long-term care is twice that of paid providers, nursing homes, and others. so that part of your wedding vows that is till death do you part, this is where the long-term care frequently comes in, because primarily it's a spouse that's a caregiver. In other cases, it's children or grandchildren that are taking care of their parents. And so as we think about it, the conclusion that we'll come to is you have to have a long-term care plan, and some of that can be how much of a burden, frankly, you are going to be or want to be on your family, or how much you can count on your family, and everybody's situation can be different. And a lot of that depends upon how long long-term care really takes. This chart from the Department of Health and Human Services is slightly updated and uses a little bit more specific criteria than the 7 in 10 statistic that Carlos quoted earlier. It points out that slightly less than 5 out of 10 individuals there in the chart on the left-hand side, slightly less than 5 out of 10 will get by without meeting the criteria of not being able to do 2 of the activities of daily living, and consequently won't need formal long-term care. On the other hand, more than half of the people, almost to that 7 in 10 number that Carlos cited, are going to need some form of long-term care after age 65. About 2 in 10 will need it for less than a year, 1 in 10, 1 to 2 years. Again, about 2 in 10, 1 in 10, more than 2 years, but less than 5 years. And then about 14% of people will need it for more than 5 years. The table on the right kind of breaks that down and indicates that men are less susceptible to needing long-term care than women are because of the life expectancy. Women in general live 3 to 6 years longer than a comparably aged male. And again, all of you know your own particular health status, and that's why for women, long-term care tends to be more of an issue than it is for men. As you indicated by the chart there, the average need of long-term care is longer for women than it is for men, and about 20%, 17.8% of women will have a long-term care need for greater than 5 years, whereas it's less than 10% of men will have that similar needs. And obviously that can be dealt with by family members, or it can be dealt with by paying for it. And so Carlos will talk a little bit more about the long-term care costs and some of the issues that we have.
Thank you, Mike. Yeah, so let's look a little bit more detail on what long-term care might cost. And the first and probably most important point about long-term care is that it is heavily dependent upon where you need that care. And so one of the things that we advise our members as they consider moving and potentially retiring from the service or just retiring outright later in life is that you have to factor in where you're going to live if you are planning for long-term care costs, because the differences can be quite staggering, especially between populated areas and remote areas. So for example, the care you might pay in New York City would be drastically different perhaps from a remote location somewhere in the middle of the country that you may decide to retire at. Now, these numbers that you see here are national averages, and they come from the Federal Long-Term Care Insurance Program website, which is actually a pretty good site for information about long-term care. And so we put these averages on here, but again, they are just that averages. But what you can see is that it's not inexpensive, especially when you start moving towards the home care and semi-private or nursing home care, which at that point you're looking at almost $100,000 of cost to provide care if you are in a semi-private nursing home. So the takeaway, Mike, is you really have to do your research about how much it costs, depending upon where you might need to get that care. Now, if you read the national papers, you may have very recently seen that long-term care is in the news. Here's an example of a fairly recent article that the Wall Street Journal ran just a couple of weeks ago about General Electric. And kind of the headline is that, it's a bad bet that insurers can't shake. And it gives the example of General Electric, who recently had to take over a $6 billion charge in its GE Capital unit. And the reason is that these costs were essentially to cover the costs associated with underwriting and providing long-term care policies through its long-term care insurance subsidiary. And so it's really important to take a look at what's going on here beneath the surface. So if I go to the next slide, please, I want to talk about this a little bit. And what we've seen in the industry is that many people relied on long-term care insurance in the past few years because we've had very successful marketing and promotion of those kinds of policies by companies that offer it. But what we see within the industry is, quite honestly, rapidly rising premiums. And an example in the Wall Street Journal article cited a couple whose premiums went up by 90%. We've had members call us whose premiums are doubling in their long-term care. And the reason for this is that this care is much more expensive than the insurance providers thought it would be for a few reasons. First, we are serving an aging population, so we have a demographic boom that is aging as a whole. Secondly, the costs for providing care for elderly people are generally more expensive than it is for young people. And then lastly, those costs of care themselves are rising. So the combination of all of these factors is rising premiums so that the insurance companies can cover the costs of providing that care. And those premiums are not locked in and guaranteed, and they may continue to rise. And for the person that is insured, those premiums really aren't accumulating value, so they're sunk costs once you pay them. Now, you do get the insurance out of it, but it can become more and more expensive. And we're even seeing now that providers are dropping out of the market because it's unsustainable from an insurance profitability perspective for many. And so it really is becoming a challenge, and it really is garnering some national attention. So what I thought we could do, Mike, is if you could, maybe you can walk the audience through what some of the options are for providing long-term care.
Thanks, Carlos. As I mentioned at the beginning, the important thing is not necessarily that everybody has long-term care insurance, but that everybody has some kind of a long-term care plan. And your long-term care plan probably will be some combination of the 5 options that are listed on there. Family care, self-funding, long-term care insurance, the Veterans Administration, or a accelerated benefits option as part of a life insurance policy. We'll talk about the last 3 in a little bit more detail, but let me just address the first 2 on this slide. I've mentioned already your family care providers. Again, everybody's in a different situation, but when you think about that as part of your long-term strategy, you may or may not want to move in near or with your children. If you've got a lot of money and can build a house and it provides a place where you could live on a first story and they will take care of you, that may be a good solution for you as a potential option. The second, of course, is self-funding. Our colleagues from AFMA Wealth Management Trust spent an entire webinar talking a lot about self-funding through your financial planning, because if you have the financial resources, that may be another very good option for you. Obviously, if you're in a long-term care situation, you're probably not spending money on other things, so that if you have funds that are available, that may be a viable option. If you have a financial planner, good financial planners will incorporate a long-term care plan as part of your overall investment portfolio. If you don't have a financial planner and would like some good advice on that, AFMA Wealth Management and Trust is a great resource to turn to be able to help you assess your personal situation to see whether or not your investments are the right answer, or you might want to turn to the option that Carlos is going to talk about, which is long-term care insurance itself.
Great, thanks, Mike. Yes, so long-term care insurance is certainly an option, and so I thought it would be important for us to at least go over some of the common characteristics of these kinds of policies to help our audience be able to research whether these might be right for them. The first thing that we see with these kind of policies is that you have to determine for yourself what a daily benefit and lifetime benefit amount would be. And so this ties back to a point I made earlier that you really have to do some homework here if you're thinking about getting a policy. Typically, you see these offered in terms of a daily benefit in amounts of about $100 to $200 to $300 per day. And then the maximum lifetime benefit can be in the hundreds of thousands of dollars. So, for example, you may have a policy that would offer to provide a $100 daily benefit and a $150,000 maximum lifetime benefit. That's just hypothetical, but that's part of the structure of the policy. Secondly, what we see with these policies is that in order to use them, they typically require some kind of certification by a medical professional, a doctor, that the insured cannot perform a specified number of those activities of daily living that we talked about earlier. That number can vary from company to company. It can be 2, it can be 3, but almost all companies require you to demonstrate from a doctor that you cannot do one or more of those activities. Next, all of these policies, or almost all that we're aware of at least, have waiting periods, or they're also called elimination periods, where the plan doesn't start paying benefit until you've been under that care for a certain amount of time, anywhere from 30 days maybe to about 90 to 120 days, depending on the provider and the plan. And on the back end, we also see sometimes a maximum benefit period. So for example, the company might say that we will only pay this benefit for a maximum of 3 years, and then we will stop payments. Now, the other thing that we see is inflation protection. And that really takes 2 forms. One is inflation protection outright, where the company would say, hey, we will grow your coverage automatically from year to year based on some assumed factor for inflation. Or secondly, they might offer what's that last bullet, which is the ability to purchase additional insurance in the future, a guaranteed future purchase option. But that's also a way to control for the rising costs of insurance and the benefit you might need. And so what those 2 things mean typically, though, are higher premiums than just a policy without those. So that's the long-term care insurance. Now, you had mentioned earlier the Department of Veterans Affairs. Mike, why don't we take a quick look? We have a poll here just to get an idea of the military demographics of our audience, and then maybe you could talk us through how we might get long-term care through the VA.
Great. As I transition the slides here, please answer the quick poll. Again, yep, as I expected, most people are either currently serving or are veterans, and so that's why addressing what the VA might be able to do is worth doing. I worked extensively with the Department of Veterans Affairs last year, and they have a whole geriatric and extended care division, which works out well to be able to address the kinds of issues that our older Americans and older veterans deal with. And that's reflected on this slide, and you can see some of the services that they have. The important thing to recognize is that this is not automatic. It depends upon the needs of the veteran. It depends upon the availability of the service. In many cases, it's dependent upon what state and what community you're in. In general, and this is not a rule exactly, but generally, the VA nursing home care may be provided for people that have a disability that is rated at 70% or greater. And so that varies based upon the individual service-connected disabilities. And then there is a greater likelihood that if the need is there and the availability is there, that a veteran may be able to get services from the Department of Veterans Affairs. And that can either be in a nursing home care or in some of the home-based care that you see on the slide. Also, you've seen in the press lately, Dr. Shulkin, the Secretary of Veterans Affairs, has talked a lot about providing additional aid for the caregivers that are helping to take care of veterans. The other thing to note on this is that this is care for the veteran and not for the spouse. So that if both the veteran and the spouse need long-term care, it may be in 2 different facilities, and that sometimes can certainly be problematic, if not just inconvenient. It also depends upon the veteran getting his or her health care from the VA medical care system. So the reason why we bring this out is, again, as the poll reflected, most of you are affiliated with the military, and so it is relevant to you. It's certainly not something that you should necessarily count on, but it's also isn't something that you would want to forget either, and it's something worth considering when you get to the need where you have long-term care needs.
Thanks, Mike. You've covered multiple options for this, and I would think that when most people think about long-term care and how to do it, they tend to default to long-term care insurance. And hopefully what people are seeing today is that there are more options than that. And I think one of the ones that is fairly commonly overlooked and yet can be very valuable is the provision of long-term care through a long-term care settlement option or a rider that's a part of an insurance company. And so many companies offer this as an option. Some charge extra premiums for the rider. In the case of AFMA, and we'll just use AFMA for our example today, the long-term care settlement option is an integrated part of every whole life policy that we sell, and it's at no additional cost to the member. So I thought it would be important to take just a couple of minutes to walk through this as an illustration, recognizing that policies, terms, and conditions always apply, but just to show our members and our audience how this could work. So if, in AFMA's case, if you have one of our value-added whole life policies or annuity life / wealth builder policy, and you are over 60 and that policy has been enforced for more than 2 years, you can use that death benefit to pay for your long-term care needs. And the way it would work is, first, as I mentioned earlier, we would ask for some kind of certification from a doctor of an inability to perform at least 2 of the activities of daily living. And if you can demonstrate that, then we would pay out to you 2% of your death benefit for up to 50 months, which would basically use the entire death benefit. So, for example, if you have $100,000 of life insurance, you could receive 2% of that, $2,000 a month, that could be put towards paying long-term care costs. And then we would ask that you annually recertify as needed if you want to continue it more than a year. And if it ends up that you don't end up needing 50 months worth of care, any unused portion would essentially revert back to insurance, and it would be payable to your beneficiary. So it really is a flexible, good option to consider. I'm a great example of this. I was lucky when I was young. Somebody told me I should get long-term care insurance, and I did, so I got relatively affordable premiums. But I have a family member that we didn't do this for, and so what we've done for that family member is we have a value-added whole life policy, and our plan is if that family member needs long-term care, we're going to use that policy to pay for it. So just a quick example of how you can put this to use, and a great option for our members.
Carlos, to make one other point, this is all these payments are entirely tax-free to the members, so that normally if you take a policy, it would be taxable, but in this case, it's tax-free to the member, and that's why the annual recertification is there. That's actually a requirement of the IRS.
Yeah, correct, Mike. Thank you.
Great. Well, thank you very much, Mike and Carlos. We received several questions earlier prior to the presentation that we'd like to address. Our first question is, do you think long-term care premiums will continue to rise?
Yeah, I'll take that one. Thank you, Sandra. The answer is yes. I think that given the demographics, and if you look again at those factors we talked about earlier that are the causes for the long-term care insurance industry problems, those aren't going away anytime soon. Our population is going to continue to age. We expect to see continued inflation in the prices of providing care. And although we do have technological advances in medical care, it still is true, and I believe it will be true still for the near future, that costs for elderly, which can be more complex, will be more than costs of care for younger people. So those factors lead me to believe that the trend is going to continue in the industry for sure.
Thank you. Our second question asks, is the long-term care settlement option the same as taking cash value of your policy?
No, Sandra, I'm glad that question came in, because it is receiving the entire death benefit, not just the cash value. For example, if you've got a $100,000 policy you've been paying in for several years, you might have $10,000 or $15,000 in cash value for that $100,000 policy. If you get into a situation where you need long-term care, can't accomplish 2 of the 6 activities of daily living, then you're getting the full $100,000 of death benefit, just as if you had died, the death benefit that your family would otherwise receive, not just the cash value, which might be only $10,000 or $15,000. So it really is a huge benefit to be able to receive your death benefit while you're alive, and hopefully you're part of the 3 or 4 or 5 in 10 people that don't need long-term care, and all of that whole life insurance payment can go to your family.
Great. Thank you, Mike. Our final question that we have today is, I have a policy whose premiums have nearly doubled. Should I cancel?
Yeah, this is a great question and a very hard question. And so the way I'd like to answer it is to say that it really depends, first of all. And so what I would advise a person in this circumstance to do is, number one, it's hard, but you just have to do some research, and you have to compare the costs of your policy to your other alternatives. And it goes back to Mike's point about planning. This is all about developing a plan for your care. You may find that your premiums, even if they increased, may be still affordable and within your budget and within your financial plan, and you may decide to continue it. But you may also find that some of these other options that Mike and I discussed today are more favorable to you. So I really, this is one of those questions where I really can't say yes or no. It really does depend. And I think the key point that I'd ask people to take away is if you haven't thought about how you're going to take care of long-term care for yourself and possibly your spouse, you have to do it. And you can't wait, because by waiting, your costs will only increase. So, maybe you can't do it today, but sometime in the next week or 2 weeks, think about this. If you need help planning it, give us a call. We'd be happy to talk to you about it. If you want to integrate this into part of a broader financial plan, our wealth management and trust company is certainly willing to help with that. And in fact, if you didn't catch it, we'll just mention what Mike did earlier, that they did a webinar 2 weeks ago, which focused more on the financial planning aspects of providing for care and the self-insurance aspects of providing for care. So that's how I'd say that.
Great. Thank you very much, Carlos. Mike, do you want to wrap things up?
No. In fact, I'll just throw on the last slide there that includes our contact information, so that if you have any specific questions, you can email us, and Sandra, I think you'll explain how people will get copies of the slides.
Perfect. Well, thank you, everyone, for joining us today. We're going to go ahead and break for now. You can reach out to us whenever you need. Please don't hesitate to reach out to us for any assistance. We do this every day for our military community, and it is our pleasure. This weekend, you'll receive a follow-up email with instructions on how to access this recording of this presentation. You will also, you are always welcome to register for future webinars and review past webinars as well at afma.com/webinars. Speaking of future webinars, be sure to join us when we go through this again with our colleagues from Wealth Management and Trust in early March. If you found this information useful, we encourage you to please share it with your friends and family. Our membership grows stronger every year because you introduce those in your military community to AFMA. Thank you again for joining us today, and we look forward to our next opportunity to assist you.